2020 can be remembered by having no toilet paper, having to work from home, not going back to school after spring break, and being so bored that you recorded an entire dance routine only to post on TikTok for a few likes. 2020 was the year that the entire world was impacted by the COVID-19 or coronavirus pandemic. The coronavirus pandemic has its origins in China. The coronavirus, also known as COVID-19, is a respiratory disease that is very contagious. On the lowest level, the virus causes a cough, a fever, loss of taste and smell, and headaches. In severe cases, it causes pneumonia, respiratory failure, septic shock, organ failure, and even death. Since this disease is novel, long-term effects are still debated. This report is being published in December of 2020 with data from early 2020. Since the coronavirus is still an active pandemic, figures and assumptions in this report may be updated or outdated soon. The purpose of this video is to use a very common epidemiological model called the SIR model. It will examine the course of the coronavirus in early 2020 in Italy, the United States, China, and South Korea. The SIR model stands for and represents three figures in a society: the susceptible, the infected, and the recovered. It is important to note that recovered may also mean removed or dead. These models are a key instrument in helping public officials, medical officials, and the general public to understand how to react to such a catastrophe.
In this model, we are taking into account three different parts of society: the susceptible, the infected, and the recovered. Because we are taking into account these three different parts, we have to set up three different equations in MATLAB using a for loop. In the for loop, we program 180 days or 180 iterations. And in those 180 days, using the for loop, we will then calculate the number of infected, susceptible, and recovered on a day-by-day basis while taking the numbers from the previous days and plugging those into the equations. Then we update those values, allowing us to determine the number of susceptible, infected, and recovered. However, assumptions had to be made in this model. The main assumptions are that no one's naturally immune to the virus, meaning that everyone has the same chance of catching it. Recovery rate and transmission rate, or the R naught, are constant, meaning they will not fluctuate at all. Once someone has recovered, they are immune to the virus and they cannot spread it. There is only one spike in the plots, and there are no failure of healthcare systems. The parameters used in the model are the transmission rate, the recovery rate, and the start scale. The start scale makes sure that the uncounted coronavirus cases in early stages of the virus are not overlooked when making the plot. For example, if the start scale is 10, the confirmed amount of cases is about only 1/10 of the actual number of actual cases. The recovery rate and the transmission rate parameters are basically what steer the direction of the plot. They are highly sensitive, and that is because the number of cases is solely determined on how fast the virus is growing or being transmitted. The transmission rate and the recovery rate are directly related to each other, and that is because when more people have the virus, more people have the chance of being able to recover. Transmission rate is a lump parameter, meaning that we are taking all the different ways that the virus can be transmitted and making them into one parameter. The ways the virus can be transmitted in big social gatherings, bad hygiene, travel, and lack of adherence to ordinances. This is the same with recovery. In this model, once someone has recovered, they are removed from the model. Recovery is impacted by the health of the people in the model, healthcare systems in countries, and the different advancement that countries have to fight the virus. For this model, we make sure the population number was always set at 1. This enables us to compare different samples of the data despite the vast differences in numbers, because every country has the same proportion of population. When examining the plot, the y-axis displays the new cases over the amount of days listed on the x-axis. This model is a discrete model because it takes us in a day-by-day basis, while the sample data we are given is taken in a 7-day time step.
Switching from the base model to the real model, it's really easy to forget that these are real numbers with real people. Adding a real-life variable, like the implementation of face masks, is a good way and a good reminder that these are real people. Unfortunately, while calibrating the base model to work with real data, it was a lot of guess and check. Once the curves matched up, we were able to match it with appropriate population density of each country and their available resources, so the data made more sense. These observations helped us tweak our parameters so they fit in the curve in the most realistic way possible. We will now look at that data.
Each country contains its own set of values applied to the set of parameter because each country is different. The parameters are different, but not vastly different, as seen with South Korea, the United States, and Italy. China, on the other hand, is vastly different. When examining these parameters and overall curves of the country, it does seem that some do tend to resist the virus better, such as South Korea. And this may be because of a few factors, such as their country's more aggressive tendency to test their people, and a better response to the virus from the very start, resulting in less new cases. The United States, Italy, and China all fit their curve rather well, but one may question the curve of South Korea due to its terrible fit to its data points. This, though, may have to do with the fact that South Korea may have taken a more serious approach to testing right from the start of the pandemic. They start at 34 cases, then shoot up to 449, but in a matter of 2 weeks, they already bring it back down to 114, showing that they might have actually handled the pandemic more seriously from the start. After examining these different aspects of the plots, the viewer has to understand that this model is a very basic model with limitations. Because of this, it is hard to tell the reason for such strange fits at all times. This model also only plots one case peak, meaning that there's no fluctuation in case number, which is not a reality. And also, reported numbers from countries have been a question thing since day one. Examining confirmed cases to actual cases complicates the model, but should be considered when digesting the results of the model. Parameter values have the ability to portray to the viewer how well some of the countries handle the pandemic from the start, and how well they are still handling it. The lower the transition rate and star scale means the lower that the country has been better prepared to fight this pandemic. They were handling the pandemic with more caution and had it more under control. As a team, we also plotted the curves of early world data ranging from February 2nd to April 5th, and later world data ranging from February 23rd to April 5th. The later world data curve fits rather well, while the earlier world data tends to be very hard to fit to the data points. We feel as if this might be due to the fact that the early world data has such a drastic change in its data. All of a sudden, the data goes from being in the low thousands, 3,000s in the first few time steps, and then jumps up to the 11,000s right after that. This may show how unprepared the world was to handle a situation of such gravity. The large increase in only 7 days shows an uncombined outbreaks and possibly an increase in testing. To better fit this curve, it would be better to use a logarithmic scale. A logarithmic scale gives us the ability to analyze a curve with massive differences in data numbers, because this scale increases by a power of 10 each time on the y-axis, allowing a larger range to be covered. When analyzing this model, it is important that it fits when plotted over a larger domain. This is important because if it only fits when zoomed in, the model would mean nothing really for the medical professionals going forward. It is only taking into account a small amount of time, when the real question is how the pandemic may look in the upcoming months.
Any model can be improved with better data. The better data in this case would be helpful figures like incubation period of the virus, a more accurate representation of infection rate, and even more about the virus biology. Another helpful data point that could be added is a standard in data collection. As our data currently stands, there's no measure to say how accurate each piece of data is. Even an estimation for reporting errors or trustworthiness would be helpful. With that said, our model predicts 2.76% of the population getting the virus in the United States. That equates to 9.1 million people. That prediction is too high, so we do not trust it. Aside from not wanting to trust that kind of spike, there is actual reasons. That spike is based off of data that was collected when testing increased. Since testing increased, cases increased artificially. With that, more cases are predicted because the increase in cases would be estimated to trend that much moving forward. Looking at the data in later 2020, there are still lumped parameters, and really, there is only one lesson to learn. Your model is only as good as the data, and most likely, your model is wrong. The silver lining in all of this is that there is a vaccine that is coming out shortly, and hopefully, us artichokes will be back on the Scottsdale Community College campus.